Today is the 801st day of our webinar. We are going to have as our guest, our teacher, Dr. Nikunj M. Trivedi. We are very glad to have Doctor with us because we do had several of the sessions with him. He is a stalwart in homeopathy. He is one of the collaborator at Radar Opus Archibald and creator of repertory of infertility. He He is honored as Fellow HMA UK. He is the Fellow at British Institute of Homeopathy. Dr. Trivedi is associated with many homeopathic institutes in UK and India. He teaches clinical homeopathy in UK. He is the Honorary Director of Education and Research of HCH. And he is going to take digestive disorders and homeopathy.
I'm very happy that today is the 800 and first day. We have completed successfully 800 interrupted. It's a great achievement for the IFPH and for every homeopath who is participating with the IFPH platform. Yes, today I'm going to speak on digestive disorder with my observation, with my clinical experience, and comparison with the conventional medicine. Because nowadays it has become a challenging for a homeopath to treat the patients, those who are on conventional medicine. They are taking a lot of proton pump inhibitors, that is called the PPI. And when they are coming to us at that time, we have to find some new symptoms along with the patient's complaint. And that symptoms is drug induced. So let us start our session. But before I start my session, I would like to share one important thing. And that is, we have to pay the homage to our master. Our master has said that I have not lived in vain. He told us that I have not lived in vain. Similarly, let us say all together that we have also not lived in vain. We will not live in vain because we are the proud homeopaths, best in the world and doing best within the limitations of our system of medicine. We are doing our best, but within the limitations of our system of medicine. If we are crossing that limitations, then it's a different story. But so far, we are working within the limitations of homeopathy, our system of medicine. We are doing the best for our patient. And that's why we must say that we have not lived in vain and we will not live in vain. Okay, now I will start my session with the digestive disorder and homeopathy. So disorder means an illness that disrupts normal physical or mental function. Any disruptions, either it's a mental or it's physical, we call it a disorder. And when there is a disruption in the digestion, we label or we call or we diagnose as a digestive disorder. So let us understand digestive tract and some accessory organs of digestion. We know the digestive tract in anatomy, but along with that, we have to consider the accessory organ of digestion like tongue, salivary glands, pancreas, liver, and gallbladder. And all these accessory organs is also playing a silent role, active role, passive role along with the digestion. And when we are talking about the digestive disorder, digestive problem, so I must say that all the problems has begun with this, with the Adam and Eve. When they ate apple, and you know, all the problem has started. whether it's a digestion, whether it's a stress related, or whether it's domestical, anything. But all the problems have started after having that apple that what Adam and Eve ate. Yes, I would say as life begins, digestive problems begin to start. When conception takes place, first conception, when it takes place, the digestive problem start coming on the surface within a few weeks of conception. And we call the first trimester of pregnancy, which is causing morning sickness to the mother. And we know it as a hyperemesis gravidarum, morning sickness. So this is the beginning of the digestive problem. Before life begins, problem starts begin. I would say digestive problem continues in intrauterine life. How? In intrauterine life, when fetal is under distress at the time of delivery, when we examine the patient by doing PV, we found meconium that shows the fetal distress. So this is another problem in intrauterine life with the digestion. Fetal is under stress, that's why fetus is passing meconium, and it shows that fetus having a digestive problem. Stress-induced digestive problem. As a neonate, we have come across a lot of patients having a colic, vomiting, diarrhea, and flatulence. With dentition also, toddler, child is reflex with profuse salivation, diarrhea, constipation, colic, like digestive problem. And in some individual, exceptional digestive disorders start with lactose intolerance, gluten sensitivity, milk intolerance, like things which come across while taking a history of the patient. So on an average, if we consider on an average, every human being must have come across one digestive problem in his or her life, from infancy to old age. If somebody says that I haven't had any digestive problem, it's unbelievable, hard to believe. And almost, as I said, that almost every individual from infancy to old age must have one digestive symptom, one digestive problem at one time. Most of the digestive problems are due to stress, food, and heterogenic causes, means caused by physician, caused by conventional medicine. Either it's a conservative or invasive. And this conservative and invasive, they both falls under heterogenic causes. So here we consider the stress as a SORA. Homeopathy having a strong miasm, SORA, syphilis, and psychosis. And stress is usually used to describe the feeling that people experience when the demand made on them are greater than their ability to cope. And that stress is causing a psychosomatic upset, psychosomatic root. And that psychosomatic cause of stress, SORA, starts from fetal distress. Then it grows with the age and it turns into an acute episodic chronic stress. And we live with that stress, directly, indirectly, passively or actively, suppressing it or expressing it. But every human being is living with the stress. And stress is also inhibiting the secretion of the gastric juices, gastric acids. and then it results into a sort of a digestive disorder. Similarly, the food intolerance, rejections, Hahnemann has explained idiosyncrasy, hypersensitivity, intolerance is a type of idiosyncrasy. A food intolerance is difficulty in digesting certain food and having an unpleasant physical reaction to them. In England, I have come across many patients having a gluten sensitivity, and that's why in supermarket, gluten-free food is available. In every section, in every supermarket, you will find a gluten-free diet, gluten-free food, from bread to pasta. You will get everything gluten-free. So food intolerance is a very, very important with the digestive disorder. Food and alcohol, salads and vegetables, meat, poultry, eggs, chicken, spicy, fermented and junk food. Small kids, they are very fond of having a burger, pizza, and chips over here. With that, they are putting on weight. With that, they are also developing a sort of a certain digestive problem. So food is responsible factor with the digestion and causing digestive problem. Leftover food. The food which has been prepared in excess that we keep in a freeze or freezer and we eat after a couple of days by just warming or heating it in a microwave or in oven, that is causing a sort of a chemical decomposition and microfermentation in the food, and that is also causing a sort of a digestive disorder. Frozen food, incompatible food. In Ayurveda also, it has been mentioned about the incompatibility of the milk and onion, garlic and milk, yogurt and fish. So this has been mentioned. So this is incompatibility of the food, which is causing, it has not been proved clinically, but in my observation, I have seen that those who are eating this incompatible food, they are developing a vitiligo. So the incompatible food is one of the cause for causing certain type of skin condition. Leftover food is responsible and it acts as a catalyst for developing a fungal infection. Tinea capitis, tinea corporis, tinea inguinalis like that, and canned or tinned food loaded with the preservative. So this all about the stress, food, which is causing digestive disorder. Now we are coming to the heterogenic cause. As I discussed earlier, that we can categorize it into two parts. That is, one is conservative, that is medical cause. Medicines can upset and induce the digestion disorder by altering intestinal flora. Penicillin, aspirin, anti-inflammatory, non-steroidal, anti-arthritic drug, steroids, antibiotics, and immunosuppressant. These are the medicines, group of medicine, which is causing a sort of a alteration on the intestinal flora. And that's why patient having a stomach upset. Patient who is taking aspirin, chances of getting ulcer in the intestine are very, very high. That's why it has been introduced as a slow release aspirin. The same way, ampicillin, amoxicillin means penicillin group. It is causing sort of a diarrhea, stomach upset. It changes the intestinal flora, and patient is always complaining of the passage of mucus in the stool when they are on the course of antibiotic. Immunosuppressant, immunomodulators like methotrexate, azathioprine, and immunosuppressants like steroid, prednisolone and all. So these are the heterogenic medical causes, but it's a conservative. While in surgical causes, let us discuss about the gastrojejunostomy. Patient having a constant gastric derangement, constant gastric complaint like hyperacidity and reflux and GERD, gastroesophageal reflux diseases. At that time, regurgitation of the food happens. The food comes over here, then goes back, causing a severe burning. And when they go to the surgeon is doing initially, they do the endoscopy, and ultimately, I'm talking about the 78, 79. I was working with one of the surgeon in our area, and he used to do a lot of gastrojejunostomy. So after doing the exploratory laparotomy, he was cutting the vagus. Vagus is a 10th nerve. Vagus means wandering nerve. So patient was not able to feel that burning sensation. And after that, patient used to develop a dumping syndrome. After bariatric surgery, also patient is developing a dumping syndrome. Means small amount of food makes patient to feel satisfied, and patient can't eat, and that's why patient is losing the weight. So this is another way where patient is developing a digestive disorder. And all this invasive procedure leads to loads of complications to the patient, and patient is coming with a different type of a modified disease picture to the homeopath. And then it becomes a very vital, important duty for a homeopath to find the exact root cause of the condition. Once we find the root cause of the condition, accordingly we can treat. And then how we go further, that I will explain later. So again, one more cause I have added, that is called the endocrine cause. Do you know about the hunger hormone? Stomach is secreting peptide hormone, which is called the ghrelin. The ghrelin, the another name is linomorelin. It's a synonym for the ghrelin. Predominantly, ghrelin is produced in the stomach by enteroendocrine cells. Entero means related to the intestine. Intestine, stomach wall, and intestinal wall having a entero means related to the intestine, related to the stomach. Endocrine means it secretes the hormone. So the cells which is underlying in the stomach wall and in the intestinal wall, they are responsible to produce certain type of hormones, and one of that hormone is ghrelin. It stimulates the secretion of the growth hormone from the anterior pituitary gland and the hypothalamic arcuate nucleus. It is responsible to increase the appetite. It increases the drive to eat. It makes us to relish the food. So it is called the hunger hormone. And that's why in homeopathy, when we compare the Baraita carb picture, stunted growth, low appetite, we should not forget the ghrelin hormone. And with the administration of the Baraita carb, the growth, stunted growth, is going to turn to a normal in majority of the patient. So assuming that Baraita carb is correcting the secretion of the ghrelin, and that's why patient having a normal development of the growth. So here, when ghrelin is interfered, when there is a low ghrelin level in the blood, so blood level very high before meal, when patient is hungry, when we are hungry, at that time the level of ghrelin is very high. When we eat, it comes down. It returns to the normal level. It also participate, this is very important, this ghrelin is also participate in reward cognition, learning, memory, the sleep wake-up cycle, taste sensation means relishing the food, reward behavior, and glucose metabolism. So ghrelin is always compared with the Baraita carb clinically. So this all about the causes. And now symptoms, how patient is coming to us. Patient always comes with various alarming symptoms like progressive weight loss, emaciation, abrotinum is the medicine for the protein caloric malnutrition, marasmus, digestive disorder, protein malabsorption syndrome. Protein is not being absorbed. So progressive weight loss, emaciation, difficulty in swallowing, dysphagia, lachesis is very good medicine for the dysphagia. Burrata carb is very good medicine for the dysphagia. Food lodges at the cardia, means at the cardiac sphincter food lodges. This also gives the indication of the hiatus hernia. Patient having a difficulty when patient eats, food lodges at the cardiac sphincter. Patient has to take a sip of water. Without sip of water, food doesn't go inside. Patient feels that sort of a tight feeling as if it is being held over there. So these are the symptoms we have to compare along with the patient's complaint. Retching, flatulence, distension, bloating, rumbling, borborygmus, bleeding for rectum, hemorrhage, whether it's a red or black, frank red or dark red, clotted. Frank red blood is from the nearby, means from the skin. If patient exerting a lot of pressure at the time of constipation, so that happens tear in the rectal area, and that's why patient get red frank blood. And if patient having a black blood, clotted blood, melena, that shows that patient must be having some internal concealed bleeding, either from the piles or from the ulcerative colitis or from the ulcer or from the polyp. So these are the indications from where we can make a clinical judgment. Okay, now vomiting, hematemesis. Esophageal varices is one of the cause when patient is having a vomiting of blood. Diarrhea mixed with mucus, constipation, acute or chronic. These are the symptoms patient presenting with a digestive disorder, and we have to categorize. And after categorizing, we have to repertorize, and after repertorizing, we can come to the conclusion that which medicine will work nicely on this clinical condition.